Welcome to Dr. Balga's podcast for the Curious Doc. Today is April 19, 2026. This video is on a New England Journal of Medicine article published on April 13, 2026. The original article is titled Endovascular Therapy for Post-Thrombotic Syndrome, a randomized trial for the C-TRACT trial investigators. There was an accompanying editorial titled, Stenting for Post-Thrombotic Syndrome, a Step Forward. Post-thrombotic syndrome after deep vein thrombosis causes pain, swelling, venous ulcers, and impaired quality of life. Endovascular therapy using iliac-vein stenting may relieve venous obstruction. The C-TRACT investigators conducted a randomized controlled trial. Study cohort comprised of 225 individuals across 29 centers. Endovascular therapy plus standard care versus standard care alone were two groups evaluated. The primary outcome was the venous clinical severity score, VCSS, at 6 months, and the secondary outcomes was the venous insufficiency epidemiological and economic study quality of life, that is VEINES-QOL, and SF36, which is a medical outcome study, a 36-item short form health survey, and also the Valletta score. The analysis included linear mixed models, multiple imputation, and intention to treat. What did they find? The VCSS score was 8.1 in the treated group versus 10.0. The adjusted difference was minus 2.0. P-value equals 0.001. The veins quality of QOLs improved by 14.5 points. P-value less than 0.001. The SF36 physical component score improved by plus 6.1 points. P-value less than 0.001. The Valletta score, that's the post-thrombotic syndrome severity scale, improved. Safety, bleeding was higher in the treated group, 11.6% versus 3.6% in the control group. P-value equals 0.03. The limitations of the study: short follow-up, 6 months, open-label design, and small sample size. Key takeaways: EVT improves symptoms and quality of life but increases bleeding risk. The editorial insight says that post-thrombotic syndrome affects 20 to 50% after DVT with major quality of life burden. The C-TRACT provides strongest randomized controlled trial evidence. The strengths were blinded outcome assessment and multi-center design. Concerns: higher bleeding risk, likely due to intensified antithrombotic therapy, uncertain durability beyond 6 months, relative contribution of stent versus pharmacotherapy remains unclear. Clinical pearls: select patients with moderate to severe post-thrombotic syndrome and iliac vein obstruction. Use validated tools like used in the study. Expect modest symptom improvement but clinically meaningful quality of life gains. Balance benefit versus bleeding risk from antithrombotic therapy. Let the patient know that the long-term durability and optimal regimen remain unresolved. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.